Good morning, and I'd like to thank the program organizers for the invitation to speak this morning, and I'll be talking about incorporating social media into your professional portfolio. I have no financial disclosures. Now, there are no shortage of websites and platforms that are termed social media, but they all work a little bit differently and they all attract different populations of users. But what they all have in common is they allow users to post content as well as interact with others. At their heart, they are all tools for communication. And worldwide, almost 50% of the population uses some form of social media on a regular basis. And it does vary by age, but you can see that even us baby boomers are pretty regular users of social media. Now, I'm mostly going to speak about Twitter because that's the platform that I use most commonly, but a lot of what I talk about can apply to Facebook, Instagram, or any of the other platforms as well. And there are three primary ways that I use social media. And the first is to filter the infinite amount of medical knowledge that is out there. By following multiple journals, including ones that aren't even in my particular specialty, but have content that are of interest, I can quickly scroll through and decide if an article is something that I'd like to read, save for later, or just dismiss and move on. I also use Twitter to connect with other medical professionals, whether they're in my field or in other fields, oncology and otherwise. And this has allowed for some very robust and interesting discussions over the years that, again, interesting and relevant to my field, but I may not have otherwise come across these medical professionals if I was only relying on in-person networks. And the third way that I use social media is for educating patients. We know that our patients are online and they are looking for answers and they are looking for support. And as physicians, there's a limit to how many patients we can reach if we're only relying on educating patients one-on-one in the exam room. I've been privileged to be a part of the BCSM, or breast cancer social media community, since its founding in 2010. And I actually serve as a co-moderator for our weekly chats. And we attract a large variety of patients who have breast cancer, caregivers, medical professionals, and really anyone who's interested in breast cancer. And it serves as a forum for sharing medical information and ideas, but also discussing survivorship issues and providing patient support. And my network, as I mentioned, is now much broader. I no longer have to rely on just my colleagues at my own institution or maybe people that I've met periodically at medical meetings. I have a very diverse and global medical network of physicians, of caregivers, of patients, of media. Anyone who's interested in the same topics I am are now part of my network. And there are really no barriers. And the relationships that I've developed over the years have resulted in some real tangible opportunities, including speaking and research collaborations. I still have some researchers that I've co-authored papers with that I have not yet met in person. And my social media presence has also resulted in real tangible opportunities, including editorial board positions with the ASCO's Journal of Oncology Practice and the Annals of Surgical Oncology. I serve as a member of the ASCO Social Media Working Group, and I'm co-chair of the Collaborative for Social Media Outcomes in Oncology. My presence has also resulted in research publications, and many of these have been a result of my partnership with patients in the online communities, studying areas of survivorship and breast cancer care that are important to patients. And of course, it's resulted in a media presence. And again, none of these I don't think would be possible without my social media presence. And these are just a few of my examples, but it's not just me. This was actually discussed in the New England Journal of Medicine a couple years ago. how social media can provide physicians with a platform and with opportunities, and especially physicians who typically have a harder time having their voices heard, whether that's women, whether that's minorities, actually anyone who's not necessarily an older white male. We tend to have a harder time having our voices heard. Social media gives everyone a platform. And it's not just medical information and medical knowledge and research. There are a growing number of sites dedicated towards sharing not only clinical information, but to allow an after hours discussion, to provide us with a forum to support one another, because medicine, of course, is a very challenging field. This is just one example of a Facebook group, the Hematology and Oncology Wolfpack group. There are groups for surgeons, there are groups for mom physicians, pretty much anything that you can think of, what your niche might be, there's a group for that. And a growing number of oncology physicians are participating in Clubhouse, a newer drop-in audio platform. And they're finding that as a place where they can share information and share ideas and provide support for one another. Now, if you're interested in getting started, the first thing I recommend is setting up a profile on all three of these sites, Doximity, LinkedIn, and ResearchGate. One of the advantages is that then when people search for you, because if they see you as someone that's interesting and credible, the first thing people want to know is, what is she written about and what's out there about her? Information on these three sites, which you completely control, can help you rise above some of the physician rating sites and other garbage sites that are out there in the Google searches. You always want to check your institution's social media policies. Some in the past have been fairly restrictive as far as their physicians having social media accounts, but that is thankfully becoming less of an issue. Make sure you have a nice professional profile and be transparent, disclose any conflicts of interest. And what I always recommend, regardless of the platform, is when you initially get started, take some time and just listen. Get a sense of what the platform's about, how it works, who's interacting and how they're interacting before you jump in and join the conversations. The best social media policy I've ever come across comes from the Mayo Clinic, and it's just 12 words. Really, in short, be authentic, be honest, be transparent, and always be mindful of patient privacy. Instead of posting a specific clinical situation where you may want to get input or comments from other physicians, post the pearl, not the patient. I think there's a lot of value in having discussions about challenging clinical situations because, again, you have now a global network of experts at your disposal, but you want to make sure that you are keeping it very general and take your patient out of the discussion. It's not that hard sometimes to individually identify a patient based on a physician's tweets. Be mindful of trolls. Unfortunately, there are some whose only purpose online is to agitate and to cause trouble. And especially as a woman in the online space, this can be a problem. Not everyone will agree with you, and that's certainly okay, but before you respond, take a look at the person's profile before you decide you want to try and engage in a respectful discussion, because you may find that there is no respect in any of their posts. And in that case, make very liberal use of the block and report feature if you need to. And also be mindful of time. Do not let this become a time sink for you. I am much more intentional and deliberate now when I go online regarding why I'm there. Do I want to engage with some patients? Do I want to just lurk around and see what people are talking about? Do I want to follow some journals? I am, again, much more intentional now. And just like anything else in your life and in your career, if you feel that going online is important for you, you'll figure a way out to make it work and incorporate it into your already busy day. And finally, I think it's important to know that it's okay to show a personal side of yourself. You want to be careful how much information you're willing to share, and that's different for everyone. But for me, a general rule is I am comfortable sharing anything that I'm comfortable discussing with my patients in the exam room, which is mostly my garden and my cats. There's nothing wrong with showing that you are, in addition to a skilled and talented clinician, that you are also a real person with outside interests besides medicine. But again, you want to be very intentional of what other parts of you want to share. And finally, for those who feel intimidated by Twitter or Facebook or Instagram or the other platforms, you are all the best and the brightest. You are most likely the tops in your class and the tops in your field. You can handle taking care of very complicated clinical situations for patients. You most certainly can handle Twitter and Facebook as well. And I thank you very much for your attention. This was, of course, a very brief overview, but if there are any questions, I am very easy to reach on Twitter and by old-fashioned email. Thank you.